Hi there! We're the Medical Battle Buddies. Your doctor might give you nutrition another way. Don't worry, we're here to help. In this video, we're going to break down the different ways a doctor might get nutrition into you. Hi, I am Niam Lee, and I have a feeding tube for crushed meds and a Hickman for nutrition. We personally know and understand how overwhelming this is, so know you are not alone. That's why we made this video, so you can pause, rewind, and watch as much as you need. Just know you got this. Hi kids, I'm Stella the Sloth.
Hi buddies, I'm Leo. I have an NG tube. That stands for nasogastric tube. Mine goes on my face, up my nose, and down into my stomach.
Stella, and I have a PICC line IV giving me 14 hours of nutrition.
By doing my nutrition in my vein, we bypass my digestive system altogether.
Feeding tubes are a big part of our lives. Always keep in mind any gear that helps you fight is something to be proud of.
You're so brave.
Think of your nutrition gear like Thor and his hammer or Superman and his cape. They use them to make them strong and more powerful.
All tubes are tools that help our bodies get what they need. Depending on the type of feeding tube you will be getting will determine your process and placement.
Some start with NG to go to stomach while in hospital for a week to make sure the body can tolerate it.
If you are getting one on your upper or lower abdomen, you will have a short, small surgery to make what they call a stoma. Stoma is just a fancy word for the hole that holds your tube.
If you are sent home with a NG, NJ,
or a
It
dangler.
doesn't always mean it's permanent. Sometimes it's necessary to give your body a break, to help it heal and get stronger.
Dangler is a little more painful and uncomfortable, but hang in there because after 90 days you can exchange it. It's very important you journal how you feel so your doctors understand what is really going on.
If you are unable to journal, don't worry.
On our Facebook page, there's a blank one you can put folded on the refrigerator and have your family fill out for you. Explain the different types of feeding tubes and know you have a right to request a more comfortable feeding tube for those doing it past 90 days.
Here's a chart of different feeding tubes. Number 1 is the NG tube and goes up nose down to the stomach like mine.
A G-tube goes directly into the stomach for long-term feeding.
The J-tube goes past the stomach and into the small intestine. It's good for long-term feeding when the stomach needs a rest.
An NJ tube goes from the nose, past the stomach, and into the small intestine.
And this one is the ND tube.
That's right. It goes from the nose, past the stomach, and into the small intestine.
And number 6 is a PEG tube. It's placed in the stomach for long-term feeding with a small, low-profile button.
Number 7 is a PEJ tube. It's placed directly into the small intestine for long-term feeding.
And this one is number 8, the GJ tube. It goes into the stomach and the intestine, so it can help with feeding in 2 different ways.
Don't let all this scare you. Your doctor or hospital will arrange it all. We share so you know you have options. That's right.
First, always make sure hands are clean.
Then check the tube and the skin around it for redness or extra skin called granulation. When you see extra skin around the tube, don't panic. It doesn't necessarily mean infection.
There are different options to treat it. A caregiver can be taught to use silver nitrate, or you can ask your doctor about less painful over-the-counter options.
It's actually a good sign. It means the body is still fighting because it's trying to force the tube out and heal your stoma hole.
But you have to take care of the granulation because it's a breeding ground for infection, because it's raw skin and blood pooling around the area.
Don't worry, if you keep it clean, dry, and use calmoseptine, you're ahead of the game. Give a thumbs up!
A fever over 100.4 degrees could mean infection, redness, swelling, or leaking around the tube site, pain, soreness, or a bad smell from the area. Speak up. Catch it early. Protect your tube.
And that's why it's so important to keep your Tubie site clean.
You all are doing a great job learning this stuff.
When doing medication through feeding tube, you will want a pill grinder that grinds it to fine powder. The reason being, chunky pills can burst a feeding tube.
I've had that happen, so my hubby bought me a grinder for $15, and I've never done that again. This is calmoseptine. A lot of families use it because it says it is for tube leakage. It can help protect the skin when tube leaks causes issues. I know a battle buddy who had 3 surgeries to try to close a hole that leakage caused.
If the syringe gets stuck, use some cooking spray on the end. Great tip! Thanks, Sloth!
Yes, that's super helpful.
If you feel sick when getting your feed, tell your care team because there is all kinds of feeds you can try.
Don't give up. You got this.
Ordering feeding tube supplies, make sure to ask for 4 long, 4 short hoses for meds.
Ask for antibacterial soft split gauze. We've learned the frayed kind will stake to blood or leakage and can rip skin when removed.
For doing medication through feeding tube, you will want a brand new specimen cup because not only does it have a lid to shake, you can see through it to know if you got meds ground up enough.
Don't worry, emergencies with your Tubie can happen, so tell your parents to keep your intervention all radiologist and doctor's phone numbers handy. In case you're wondering, interventional radiologists are the ones who handle tube issues, placement, and exchanges.
If you keep it clean, dry, and use calmoseptine, you're ahead of the game.
If you see redness or irritation, tell your care team. And change your gauze pad to help avoid infection.
Make sure to tell your doctors if it hurts during tube exchanges. They will give you something, as we were told 50% of patients have pain during exchanges. Another way people get nutrition is through a PIC, Central, or Hickman, which are all IVs that go to the heart.
Let's learn about super tubes. These lines pump nutrition into your veins.
Your body's superhighway. Central lines and PIC lines deliver medicine and nutrition right to your heart. You're a body superhero.
Lines, you have to keep everything sterile to reduce risk of infection.
Every time you set up TPN or set up IV meds, you will want to alcohol the laminated mat.
Make sure to wear gloves when setting up TPN, because that will help keep bacteria from entering the line.
Hi! Let's learn how to avoid IV infections. Change the end, use a sterile cloth, and scrub with alcohol. Wear gloves and act if it's not flowing!
At the end of an IV line, blood can naturally coagulate, and that can be a breeding ground for infections.
So we have to keep everything clean.
There are all different kinds of infections, and every single body may react differently. We want to share 7 warning signs that was not only overlooked for months, but was misdiagnosed.
Signs of infection can vary and are not limited to the following.
Number 1, pushing difficulties. If caregiver, nurse, or parent has any resistance when pushing into TPN line, then our PIC team said,
If it's not flowing, you have to get going.
This means you have to go to ER or PIC team to troubleshoot and do blood cultures to rule out infections.
No blood return. If your care team says this is normal, kindly say, I'm sorry, that's not up to date. No blood return can be a sign of infection.
Warning sign number 3, muscle pain. Your muscles hurt all over. This is a serious sign. Tell your care team right away.
Warning sign number 4, a bad headache that won't go away. If you have this, tell your care team right away.
Warning number 5, night sweats. You might wake up sweaty and need to change your clothes. This could mean an infection. Tell your care team right away.
Warning 6, shivering and cold. You feel very cold and can't get warm. This is a sign of infection. Tell your care team right away.
Warning number 7. High or low fever. A fever higher or lower than normal can signal a serious bloodstream infection. Contact your care team immediately.
Sometimes Tubie friends get body aches.
Or headaches that make you feel yucky.
But don't worry, we can help. Tell your grown-up right away.
I've seen stories where people have lost legs, arms, and some their lives just from sepsis.
That's why it's so important to tell your family, caregiver, battle buddy, and/or doctors of all your symptoms.
The earlier you catch something, the better your chances are.
Make sure to ask your supplier for a week's worth of non-refrigerated TPN. You never know when you'll have a delivery issue, supply issue, or have to travel in an emergency.
Have your supply company give you a box of gloves, masks, and dry towels to put on your lap or table so the surface is sterile to work
Want to designate ahead of time where to put supplies in a counter or space that can stay clear to place the laminated mat the supplier will give you.
Being a Tubie Warrior doesn't mean you're broken.
It means you're chosen for something special.
We are chosen.
What does it mean to be chosen?
It means you're special and cared
It
for.
also means you will meet people in waiting rooms, operating rooms, and doctors' offices that give you a chance to reflect God's love and thankfulness for He's done for you. How you do that is by being kind, compassionate, and thankful.
I always thank my care team for all they do. I appreciate you, in case you haven't heard it enough.
Welcome to the Tubie life. Some days will be long and hard, but we'll be here to laugh, play games, learn, and dance our way through it all together.
Check out our Facebook page, Medical Battle Buddy Club. We have a newbie Tubie kit with tips for new Tubie families. It's full of suggestions from battle buddies who know what it's like. Your Tubie lets you be a superhero.